mentioned earlier, or you advised people should get that mentioned to measure. Looking at our situation in Africa, the economic problem there. So if that person is not able to buy that equipment, where do you think he or she should go in order to?
Oh yes. Thank you for reminding me that that's a bit of an oversight. Yes, I do know in our population back in Nigeria particularly, yes, we may not, majority of us may not be that fortunate to be able to buy that machine. But luckily, we do have several ways.
Okay.
I'm sure you would know a nurse that you can ask to check your blood pressure. You would have a clinic somewhere that you can go and get your blood pressure checked. Even the pharmacy around the corner, a lot of them, I'm sure, will be able to, on a small cost, a small fee, of course, would be able to do that blood pressure check for you and then say, yes, it's okay, or you need to see your doctor about it. So yes, we don't all have to have a machine. There are other ways that we could get our blood pressure checked.
Oh, that's brilliant. And really, someone asked, what are the causes of this high blood pressure? So somebody asked this question that she really wants to know what the causes are.
There are numerous things, but for the majority of us, it starts off as what you would call essential hypertension. You don't know. Most times it runs in families. And if you lose sight of those early stages, then what then will bring it to your attention is when you're having this secondary damage from the hypertension, its impact on the end organs. Screening back home is a problem because sometimes there are some kidney problems you can have in children. You miss out on that. By the time they're getting into their adolescence, late teens, young adult years, that's when they begin to manifest as having BP. But if you look into it, you find out that they actually had kidney problems from the word get-go. And that's what resulted in that. There are medical conditions as well that, if not well controlled, you end up with high blood pressure. But that's a secondary effect of the primary illness, diabetes being one of it. And back home, I know there's a lot of type 2 diabetes, which I think we'll be speaking on a bit later. But part of the problems you can have with diabetes, actually they go together. You're having type 2 diabetes, you're fat, hypertension is part and parcel of it, as well as having high lipids, or as people call it back home, high cholesterol. They tend to go together. So it's our understanding that these things go together. And when you have one, even if your doctor is not bringing it up to your attention, you subtly remind that could he or she check this or that. So really the majority of cases, the commonest is essential hypertension or idiopathic, I don't know. Then the others are, you begin to screen to find out what is causing the hypertension. And I think we'll speak a lot more on it later.
All right, okay. That's fine.
If I add on to what Dr. Osela have explained, for most of us, the high blood pressure is essential high blood pressure, like she said, which is something that creeps up as we're aging. As we're getting older, our body starts to wear and tear, as we say it. Imagine you have a car, you have to maintain it. So as we're getting older, we also have to look after our body. And hypertension, high blood pressure, is one of those conditions that will creep up without us noticing. There are some other people which are unfortunate because they have got one or two other problems that may well cause the high blood pressure. And those ones mostly will be diagnosed in younger age. Kidney disease, for example, will be one of them. And then there are other people as well, which the high blood pressure is predominantly because of lifestyle, what you're eating, how much salt is in your diet, How much alcohol are you consuming? How much exercise do you do? What is your weight? Are you overweight? So these are things that can also be a cause of high blood pressure. And a majority of these things are things that we could actually change to either prevent the high blood pressure from happening, or if it's happened, we can change these things to try then to manage the blood pressure better.
Oh, and that's really. Is there any relationship, like if one has high blood pressure, is it advisable to take caffeine or snuff? Like, I know some people in Africa, they like taking snuff and energy drinks. All these young guys, they really like energy drinks. So is it advisable to combine these drinks or whatever when one has high blood pressure?
Dr. Chioma made reference to that actually when she was talking about lifestyle. And there are particular foodstuffs we kind of have every day that can contribute. It's not the sole cause, can contribute towards hypertension. Like we use a lot of salt, either in the form of Maggi or one seasoning or the other. We do. We eat a lot of palm oil, and palm oil comes into the lipids and whatever else. Then we're into this, I don't know what you call it in other dialects, but I know in the Igbo language it's called akam. So or potash as the English would. But if you think about the potash or akam, we use it in so many ways. Because I'm Igbo, I'm going to learn towards Igbo because those are the words I know I can throw out in Igbo language. So, like the akam, you use it in making this your nkwobi. You use it for, some use it for thickening or in a variety of ways. Calling it akam, everybody knows what it is. But you use it to soften your okwa. Even beans, the honey beans and the ivory beans and all those beans. You use it to soften it, just to reduce your cooking time. But they do contain a lot of potassium in it. And potassium, if one, there's no need going down into paring it down, what happens in diabetes, high BP. Anybody who has high BP should cut back. If it's possible, stop taking all those things. Where there's too much salt, potash, and snuff, as our elderly people tend to do. Some people actually chew it. And you need to wonder, what is the... there must be some fun there for most, but actually, not only does it not help you, but I believe it might have some contributory factor when you're talking about oral cancers and stuff like that. There are habits maybe we've grown up with through our forefathers, and those are the things we've learned. But times have moved ahead, and we are in a position now to modify some of our lifestyle that has been identified to be detrimental to us, and it's easy for us to modify those. Alcohol in particular does not help anybody. Smoking does not help. Call it tobacco, call it hashish, call it whatever you want to call it. Cigar, whatever. Things in moderation, I can say, because some people tell you, I can't do without. But doing something in moderation is okay. But when it's so excessive, and we are getting towards the autumn, winter years of our life, it's not going to benefit you in the long term. Because by the time you're hitting the 60s and 70s, that's when the excesses of your 20s and 30s will begin to catch up with you. And it's basically try and do whatever you do in moderation. Key things, if you're unfortunate that you become hypertensive, then modifying your lifestyle. And those things you can do to modify it, they come cheap, they don't cost money. Eat less meat if you can. Drink less alcohol, smoke less. Don't always call your driver to take you from point A to point B. So if you can actually walk, it helps. We have a beautiful weather. The sun's there, you're going to sweat, and because you're going to sweat, you're burning some calories. And those are the things you're looking into. I can understand that if you're going a far distance, then there's a need to go in a car, but take up one exercise. It's called lifestyle changes. You exercise, you eat healthily. You exercise, you eat healthily. You get a good balance. And not only from the BP point, your general well-being, the benefits you cannot really begin to quantify easily.
Oh, thank you so much, doctors, for this informative message. And there is another thing, that is something that came into my mind right now. You know, when a woman is pregnant, so doctors always advise to check your high blood pressure often. Why do you think that a pregnant woman should always check her high blood pressure?
Yeah, that's very, very important, really, if we focus this on our mothers. During pregnancy, the woman's body is catering for the woman and also for the child. And as a result, there's a lot of hormone circulating, flowing through the system. And this hormone would lead to increased blood quantity, so that there will be enough to carry nutrients and oxygen both to the pregnant lady and the child. So because of that, there will be a lot of work, a lot of burden onto the heart to carry this extra load. Plus the woman is also retaining water as an effect of these hormones, these pregnancy hormones, which is all natural to the body. Therefore, it's important during the antenatal care, which every pregnant woman should strive to attend. The blood pressure is very important to check, because with the extra burden and the extra load, the extra blood circulating, the extra water in the body, all of this will lead to the blood pressure rising. Which then some women unfortunately will develop pregnancy-induced hypertension. And with that pregnancy-induced hypertension, there is a risk to the pregnant woman. They can, of course, the end result of high blood pressure, stroke or a heart attack. And that there is also a risk to the child. If the blood pressure is that high, it can actually have a negative impact on the child, because it can reduce the blood flow to this baby, which sometimes will end in a miscarriage. That's why, for these reasons, during pregnancy,